Hey, Cam followers, it's nice to be back. It is a Tuesday. We are normally Thursday, but to pin this lovely dude down, we changed the date to Tuesday. We got the awesome Dr. Mark Lowrie back, and we're going to be talking about trying to distinguish when something is pain-related, musculoskeletal, when something is more neurological, because believe it or not, they can look very similar. And it is a little bit of a problem trying to decipher what is what. First of all, before I let the lovely gent introduce himself, I'm just going to do a little bit of a pick me up about a CAM endorsed products, which is actually quite relevant about tonight. So we do endorse this product. There's very few things that we endorse. This is by a company called Floors for Paws. It is a very specific product within their range because I am extraordinarily fussy what I will put Cam's name to. It's called Paw Safe. It is a flooring. It's a laminate flooring that offers supreme grip. And this is something that is really important. If you followed Cam for a while, we do believe more rugs, less drugs, because the home environment can become quite treacherous to dogs that have mobility impairment. So if you're looking at putting a new flooring in your commercial building or your private home, please do go and look at Floors for Paws. 10% of the profit of this flooring goes into Cam to keep us going. So you are going to also be supporting Cam. Right. I'm not very good at a salesperson, so there you go. Get that out of the way. Now, let's talk about what we want to talk about. Tonight, we are trying to help you guys understand that lameness, changes in gait, a weird walk, weird postures doesn't necessarily mean OA, because a lot of people go, oh, it's walking weird, it must be arthritis. So please, Mark, introduce yourself because you are awesome. Let everybody know how great you are.
Wow. Yeah. No. Well, if you've followed it before, so I'm Mark and I work at Dovecot Veterinary Hospital. So that's a hospital roundabout Derby way. And what we do there, we are predominantly neurology and orthopaedics. So my side is neurology. That's what I focus on, doing neurological problems in dogs. The orthopaedics is obviously something you'll get a lot of people on here speaking about orthopaedics and arthritis. That certainly comes under neurology, but rather than me looking at the bones, I'm much more interested in nerves, the spinal cord and the brain. And I find there's a lot of overlap between the two. So it's quite nice when I work with all these orthopedic specialists because we have a lot of cases that it can be really difficult to tell. And that's what hopefully tonight we'll be able to discuss some of them and try and work out ways to tell between those two problems.
Yeah,
but yeah, very much.
Even now we have to remember we can get combinations too. And I think a lot of people, I know from being a first opinion practitioner, people want to come in and they want to have it all pushed into one problem. So much easier when it's just one thing. But we're talking about neuro, we're talking about ortho, but there could be a bit of both. So let's crack on. I'm going to give a run through of what we're going to try and achieve. We've got a bit of an agenda going today. Before I do that, though, something that's been working really lovely is tell us where you're from, listeners, because we've got people that kind of come and listen, and we're getting quite a good global audience, which is lovely. So take a few minutes and tell me where you're listening from. So tonight, what we're going to do is basically start talking about lameness. We're going to be talking about all the different causes of lameness, what lameness is. And then we're going to talk about how actually it's just not always OA related. I know I'm obsessed with OA, but I have to admit there are other underlying reasons. And then we're going to talk about how we actually use the clinical examination and listening during the consultation to the history. We use static and dynamic observations to try and distinguish the two. Then we're going to talk through a few of the common underlying pathologies that you see that often get overlapped with OA and how we can have a misdiagnosis. So we're going to be covering a lot. Bear with. Right, let's start at the top here. Clarification of lameness. So I did write this agenda last night for Mark. It doesn't solely mean limping. Please talk to us about the dogs that present to you that have neurological signs, but how it could be also off. Tell us.
Yeah, well, lameness, absolutely. So we know lameness can happen because you've got problems with your bones and arthritis. So that's a really common cause and probably the cause most people think about. But it's really interesting because you can definitely get lameness for neurological reasons. Some of the things I'd think about would be trapped nerves. And whenever you've got a trapped nerve, and we get this, we have to think about, if you think about yourself in this, it really helps. That when you get a trapped nerve, you can be very, very painful in your legs. And one thing I've found, the way I've used over the years to work out whether it's neurological and relating to the nerves, or whether it's a bony problem like a broken bone or an arthritic bone, what I found is if you've got a dog that's stood there holding its leg up really lame, like I call it fracture lame, where they literally can't put it to the floor, it's that sort of held up. So if they stand there and look like that, but then when they start walking, they're only a little bit lame. So you might still see the lameness, but it's much, much better. That for me is much more of a neurological lameness. That's much more a nerve problem.
So if they're holding it up, you're thinking, ooh.
Yeah. So if it's more obvious when the dog's resting, that's what I'm getting at. So it's a leg that's being held up. Maybe they've got a bit of weight on it, but it looks really sore. But then they start walking and it's not so bad. That's really helpful for me. That tells me it's more likely neurological, because of course, if you've got a dog that's holding its leg up and it starts walking, it's not putting weight on it. Well, that is when you start thinking of the more serious problems like fractures and things like that. But if it actually improves when they're moving around, it makes me immediately think of a neurological problem rather than orthopaedic.
Nice. And I think that's a good point to actually say to people that also with arthritis, if they're really 10/10 lame, start thinking outside the box. And I think that's something that always breaks my heart a little bit when people have bided their time. They're like waiting to see their vet in a couple of weeks and the dog's being really lame, but it's just the OA flaring. You're like, whoa, 10/10 lame? I'd get that checked out sooner than later. Fair to say.
And we see that really commonly. Dogs that come in and they've been lame for ages, like quite mildly, but it's really flared up. And because they've always had that arthritis diagnosis in their head, they may overlook the new things that might have happened. That's really common.
Yeah, absolutely. So I think also the thing that I want people to kind of start thinking about, when you hear the word lameness, it's become really interlinked with limping. And that's what people associate with. So when you say to somebody, your dog's lame, and they're like, no, it's not. And you're like, well, he is, because he's walking really strangely. He's very stiff. He's very rigid. He's like soldiers walking, or he's dragging a toe. Oh, I didn't think that was lame. That's just how he's walked for ages. So can you kind of talk about the sort of lamenesses that you see, not just limping? Because people always just think about holding up paw, because that's like acute pain lameness. Oh, I don't want to use it because it's acutely painful, I'm going to hold it. But there's other ways that animals can present lameness. Yeah,
definitely. Well, I think you can be weak as well. So weak's another one where you almost collapse on the leg a little bit. So as you're walking along and you put the leg down, your weight sort of you can't bear weight on that leg, and it sort of almost collapses with every stride. Yeah. So we see that a lot as a form of lameness in neurological disease. And the big one, the one I'd really want to talk about, is the term, we like to give them fancy terms. We like to call these fancy gaits things like ataxia. So ataxia, I might have mentioned this last time, but it's always worth bringing up. That ataxia for me is a word that a lot of vets will throw around. And I'll be really honest, I'm one of the vets that used to throw this around without really understanding what it meant. But what I've learned about ataxia is if you can spot that in your own dog, you know your dog has a neurological problem. And it's kind of made you focus less on the orthopaedic problems, arthritis. So ataxia for me literally is a word that I would say means drunk. And that's the best way to think about it. So if you're watching your dog walking along, if it's a bit stiff, if it is lame in some way, if you use the word lame, have a look and see, does it actually look a bit drunk in its legs when it's walking? Is it sort of crossing over like this as it's walking? So if that's happening, it's not just an arthritis problem. Now, as you've said already, it could well be arthritis is a part of this condition, but actually maybe there's something else going on that's causing the dog to be wobbly, if you like. So looking out for drunkenness is really, really helpful.
Yeah. And I think that is, it was a real big take home from tonight, is that people really do believe that their animal, their pet, will only get one thing. So when you get a different variation on top of the previous presentation, quite often that kind of slips under the radar. People think, oh, it's just the OA getting worse. When you see change, it's always worth getting it checked out. we've had the lovely Dr. Tom Harcourt Brown, who is a good friend of yours, on. He was also talking about toe drag and how that always flicks there's going to be something neuro. Do you feel the same?
Yeah, I do. Actually, mentioning that, I think with Tom, he would probably bring up the same sorts of cases. There's probably quite a, I don't want to say common, but there is a problem we see a lot in dogs. And so these are older dogs that have been a bit stiff over the years, getting stiffer with age. And maybe it's just been very slowly getting worse. Now, that could be arthritis. It definitely could. But what can sometimes then happen is it gets to a point where a dog is dragging their toes, and they're almost, rather than putting them like, oh, I can't, where's my camera? There. Rather than doing that, they'll actually knuckle their paw over.
Yeah.
Like that. So that it might become really obvious and they stand there with their paws knuckled, but it might be actually as they're walking, you hear them dragging their claws on a hard surface. Another one actually is in snow and sand. They're brilliant times to see it, because if it's been snowing, or if you're on a sandy beach, you can actually see the claw marks being dragged. So you see lines associated with it. And that can be helpful to really pick it up, because you don't always hear it and you don't always see it. I mean, I'll be honest, I can watch dogs that I know should have it, and I don't always pick it up. It's hard to look at. So walking them on those surfaces can really help pick it up. And the other big thing in these cases that I'd always ask people to look for is they can start to have problems with breathing as well in these older dogs, because these are dogs that have got a nerve disease. So it's called a neuropathy. So with age, particularly common in Labradors, but any dog can get it, they can start to get degeneration of their nerves. Their nerves kind of start dying away. And so it causes them to drag their feet, but the nerves that also control breathing become affected. And there's two things you would see with that. So you'd see dogs that are less tolerant to hot temperatures and things like that. So in the summer, they might be running around and you're just finding they tire more easily. They look more out of breath. But the big one for me that a lot of people notice but don't always mention is their voice changes. So rather than your dog barking a big deep bark, they get kind of quite a high pitched goose honk type noise. So that their voice can change, but people don't think to mention it because it seems so separate to the gait, to the lameness and things. But if you pick that up in a dog that's been arthritic for a long time and getting worse, that again just makes you think, well, maybe there's something more than arthritis going on. So toe dragging and voice change are two massive things that I would be looking at with with
that. Gait. And I've got a lovely story. I had an older spaniel client, and they were very much at that decision of, is it worth intervening? So peripheral neuropathy, it had laryngeal paralysis, it had mobility issues, both peripheral neuropathy based plus OA. And they really, really couldn't decide whether it was worth going through having a tie back. And they went for it, and dog's life changed, had another 2 years of really good quality life. And you kind of, it's very my opinion, but it is funny how as our dogs get older, we kind of start making decisions of, is it worth it? And anybody that finds that conversation difficult, there are many reasons that it exists. But if you as an owner kind of sit there going, I don't know how I feel about that, is it worth it? My dog's elderly. Have a chat with your vet. My dog had major liver surgery at 13 and a half and had another 2.5 years. So I'm not saying it's right or wrong. I'm just saying, if that's how your mind works and that's what your beliefs and your ethics and your relationship with your dog, don't be scared of having that conversation with your vet, because some of these dogs do very, very well. Is that your experience as well?
Massively. No, I was going to say a tie back for me in these dogs that we're talking about with these neuropathies, if you like. So degenerative neuropathy, laryngeal paralysis. The laryngeal paralysis, it seems to be the biggest problem for them in the grand scheme of things. So if you can do something to help with that a little bit, all right, we're not going to make them run around loads more, but actually they do run around much more because it's the breathing that's making them not want to exercise, not the arthritis. That's sort of, we know what a 12-year-old Labrador looks like when they're running around, or what they should look like. And if you don't have a 12-year-old Labrador that's running around like other 12-year-old Labradors, there's probably something else going on there, whatever it might be.
Yeah, definitely. And it is like, as I've got older as a vet, communication is the biggest thing, isn't it? And I know that there's many owners that feel really inhibited about having these honest conversations with their vet, and they feel very restricted. Do go and find that vet in that practice that you can really have a good conversation about what you feel about your dog. Because I think some people feel that older dogs, I don't know, they get kind of a little bit written off sometimes. Horrible to say,
no,
but
that's fair. I agree. And actually, I think it's good because if you'll find all vets will have a number of different options that they could give your dog, if you like, to treat or diagnose. And it's not always true that they'll be able to tell you all of them. Maybe they're limited by time. Maybe they feel you're going one way more than another. So if you want more options, always ask them. I think it's always worth doing, because vets will always say, well, actually, yeah, these are the 5-6 options. And they may say, and I'll do this. I know I do it. I kind of go, well, actually, these are the 5 options. I personally like option number 1 myself, but I can see in your case, maybe 2 or 3 would be better.
yes,
Give all the pros and cons, because some of them do have big pros and cons. And if you understand all of them, it helps you to make more of an informed choice. So I feel really, really passionately about that, about having that time to think through the options and making the right decision for you and your dog.
Yeah, I agree. And just finishing that off, I think also you're allowed to go away, think about it, and ask for another conversation. So I have many owners that feel a little bit overwhelmed with choice, in that you've got option A to option F. And they're like, oh, 10 minutes. This isn't countdown. You can leave. You can go home. You can think about it. We can have this conversation by email or by phone, and we can actually come back to it. And I often say, take the weekend to think about it, and I can speak to you again on Monday or Tuesday. So I sometimes think the 10 to 15 minute like consult construct we have, people do feel like they're on some kind of game show. I've got to come up with an answer. You don't. You can think about it and come back. So that's our little kind of maternal and paternal support for the CAM followers. Right. So we talked about lameness. And I've written in my notes different sources of lameness. We've already touched upon OA, being canine arthritis management. We've talked about neuro because of Mark Lowrie here, but we've also got to consider more like mechanical lamenesses, in that if you did have a joint that's maybe end stage, it's not actually that painful anymore, but it's really restricted in the way that it moves, that can create a abnormal gait, but there isn't actually underlying pain really driving it. So we just want you to step away from seeing lame dogs and thinking it's always going to be OA. There is definitely big reasons to get a vet check and get them worked up, so we can get to the bottom of that cause.
And you've touched on something else good, Anna, actually. What I would say to add to that is the other thing is lameness people always think is painful, and it is a lot of the time. But actually, if you have your elbow or your knee fixed, if someone just fixed it into position, you're going to look lame, but you're not painful with it. You just can't move it very well. So it's always important to say, just because your dog's lame doesn't mean it's necessarily painful. So that's another one I'd want to add.
Yeah, definitely. We did it to Luna the other day. She had to go to a primary school visit. She got bandaged again and again and again by 6-year-olds.
So yeah, she would have looked horribly painful.
They wiped out her forelimb function, and she kind of walked out with these massive leg warmers. She was lame as you like, but she wasn't painful. She had no carpal elbow flexion at all. But yes, it does exist. Okay, moving on to the next one. So we've already talked about lameness is not pathognomic for OA, which is a sad belief in older animals. This is just an area that I wanted to touch on. OA, sadly, is always connected with older animals, when actually it is a younger dog disease. But you probably have this the same with your clients as well, in that, let's talk about these neurological diseases that can cause gait changes, gait abnormalities, postural changes, lameness. Is there a similar trend as the dog gets older? People just kind of lump it as OA when these diseases are more prevalent as they get older as well. That's what I'm trying to say.
Yeah, no, absolutely. So I've mentioned the problems with nerves, so neuropathy. So you get degenerative neuropathies. Degenerative just means it gets worse with time, and neuropathy meaning nerves. So you get nerves that die away with time, and you get weaker and weaker. So we've discussed them, and that's one part of it. But the other things to mention are more diseases of the spinal cord. So I always think of the spinal cord like an electrical cable. So it links the brain with your dog's back legs. So the signal's far from the brain. They travel down the cable and they power the back end. But if you've got something that's pinching those nerves or causing the nerves to die away, you'll get wobbliness and ataxia, drunkenness, if you like, causing you to be weaker and weaker in your legs. And the two big conditions I think about in older dogs would be slip discs. So intervertebral disc disease is one. And the other big one I'd put there is a condition, it has lots of names, but degenerative myelopathy is probably the one it's most well known by at the minute. It used to have be called CDRM as well. So canine degenerative radiculomyelopathy, but they're both the same condition. This is degeneration of the nerves over time. So we could talk about each of them, I guess.
Let's do it.
Degenerative myelopathy is one that traditionally has been considered more of a disease of German Shepherd dogs. So that's the breed you'd most commonly expect to see. But I think it's fair to say now any breed can get it. There are some that are a little bit more common than others. And I don't think it's fair to mention one more than another because I don't want to steer it more than one way. But German Shepherds definitely. Other breeds get it a fair amount too. But these are dogs that will get misdiagnosed by a lot of people as being arthritic because these diseases progress over 6 to 9 months. So you'll start off with a dog, it might be really subtle to begin with. It might be a dog that isn't jumping up much or isn't like as playful, not running around. They won't be painful. You might see signs that make you think they're in pain, as in they might look drunk, but actually they're fine otherwise. But very slowly over time, these dogs get more and more wobbly. And it's hard to spot it sometimes because you're living with your dog day in, day out. And so you don't necessarily notice the slow change. It's often friends and family and neighbours who'll say, oh, I don't know, Arthur's looking a bit weaker in his legs at the minute. So, he looks like he's getting weaker and weaker. And you're not seeing it because each day you're with that dog and you're out walking him or whatever. You won't see it happening. So that is something I'd be mindful of. I suppose we can't treat that condition, but what we can do is we can start some interventions earlier to help that patient. So if we can get that pet early on, and get some physiotherapy and that sort of thing involved, do some like pole work and all sorts of nice things like that for them, we can actually give them a much better quality of life for longer and maybe slow the progression of the disease. But also it's important to not kind of misdiagnose it and call it arthritis and put them on pain relief that they don't really need.
And spend people's really important resources in the wrong direction. And we do see that, and you just wish that people would have the opportunity to kind of review. Like, don't get me wrong, there are many cases where we've put them maybe on a non-steroidal with the best intention, and if that owner came back and had a review and we're like, well, are we seeing a really good improvement? Non-steroidals are a treatment of choice for OA. And if somebody went, not really, you'd be like, let's look at this again then, because non-steroidals and OA like each other.
I do it actually. I've been known to put dogs on them for a period just to get that feedback. So, I quite like it if an owner comes back and says that didn't work. That's great. That's helpful. That's really useful information. So a lot of vets will prescribe it just to find out, is their dog getting better or not? And if they're not, that's fine. Don't be afraid to tell the vet that. Vets don't mind hearing that. Vets want it. I want to hear that. I want to hear, well, that didn't work. So it means I can rule some things out and start considering other options.
And that's another massive, like Hannah and Mark support phrase. Don't tell us what we want to hear, guys. I know that sounds really daft, but there is something called the white coat effect. And people come into the room, it's almost they get a bit of stage fright. And you'll say, is he better? And they'll go, yeah, he's better. And you're like, be honest. Tell me what you see.
Spill it out,
Come on, just get out. Because I think sometimes people get a little bit inhibited and they get a little bit, as I say, stage fright, and they just say something really quickly. If you are not seeing improvement, don't doubt yourself. I think some people feel that they might not be observant enough, or they don't know enough, or they're not the vet, so they can't really comment, and they'll be like, yeah, I think so. No. If you don't see improvement, you say, I haven't actually seen any benefit to this, because that is part of the diagnosis, and it'll be really, really helpful for us. So good job. I think this is a definite thing to consider. We have many, many therapists that follow this page and the CAM. I do totally understand where Caroline's coming from, and I agree with it. When we talk about no pain, we're talking about to the primary area of pathology. So in these dogs, they're very unlikely to have any pain around the hindquarters. But yes, you're right. The forequarters are now going to start taking on a hell of a load because they're doing more work, and you are likely to get soft tissue pain, myofascial pain, etc. So these dogs still do benefit massively from having physiotherapy, massage therapy, whatever, acupuncture, laser therapy, because you're lightening the burden on the compensator area. Because when that goes, we ain't got nothing left. So you have to support it. My phrase that I talk to people about, and you might like this, 4/4 is the tugboat, back is the anchor chain, back legs are the anchor. We need to look after the tugboat. And people are like, oh, yeah, because they're so focused on the back end and, you know, having the cart, having the harness, having all that support, they forget that the front end is working stupidly hard too. So good point, Caroline. Like it. What's the other common pathology? So we've done DM, and I love
the other one.
Yes, Karen.
Go on.
No, I love the fact that you were really quite keen to just talk about physio, because I think DM is another condition where people spend a fortune, and they go on the hunt for the holy grail, and they'll spend a vast sum of money on supplements and interventions. And you said the honest truth, there isn't a huge amount out there that can really influence it, is there, except for physio and rehab?
Yeah, no, it really is. Unfortunately, I mean, that's a hard conversation to have with anyone, that they've got their dog that's coming in, getting weaker in the legs. There's lots of things you can do to investigate that. And people might go down the route of MRI scans and things, and that can be really expensive. So you can get owners that spent a lot of money to get the answer that their dog's got this degenerative myelopathy. And then there really isn't much. And I understand it, because I think if we have to put ourselves in the shoes of, if we were given a diagnosis that was life-changing and, well, you know, it would actually potentially lead to having to put a pet to sleep, you're going to go out and you're going to look for every single possible thing and cling on to everything you read. And I think that there's something that vets always say, and they say if you know, often you'll say, well, you know, what about such and such treatment? And you'll very commonly hear vets say there's no scientifically proven evidence that it works. Now, all they're really saying there is, you know, there isn't anything that tells us it work. It could work, but I never want to give false hope there, because I think if we haven't got scientific proof, we can't endorse a product. We can't say it will definitely work. Many of these things may do no harm, depending on what we were talking about, but they're never really, I mean, in something like degenerative myelopathy, that's such a severe condition, there definitely isn't anything out there that can cure the condition. So people talk about things like vitamin E, all the different types of vitamins you can give. I know there's a lot of things written out there that some people feel it might have helped their dog, but I think sometimes knowing what a condition is helps a person come to terms with it, because actually knowing what's wrong with your dog, you can then change how you manage them. So yes, it's an awful thing to hear your dog has, but you can change loads of stuff at home to let your dog get around more easily. You can be aware they're not painful, so exercising them is a great thing to do. I actually encourage people to take them out and exercise, and that's where I come. This is why it's important sometimes to distinguish it from the other pathology I was thinking of, which is intervertebral disc disease, because when you first suspect that, actually the best thing is to keep quite restricted. Whereas, as I've said there, degenerative myelopathy, you want to be running around and, you know, doing everything. So getting an answer in those cases can be worthwhile. However you do that, whether you go with somebody's best guess. I mean, I say that to people. My best guess sometimes is what, you know, what people want to hear. They say, well, I can't afford the MRI scan, but what is your best guess here? How do you think we should best manage our pet with this condition? And so degenerative myelopathy, all about activity. A disc problem, as with us, if we had it, you're not going to run out and do a marathon. You want to restrict yourself, keep rested. So disc disease looks very similar to degenerative myelopathy. Dogs with wobbly back legs, progressively worsening. But the big difference for me is disc disease can well be painful, you know, for sure. Not always, again, you know, it's not a clear-cut thing. But dogs with disc disease tend to be more painful. And it leads me back to something we said even earlier about the lameness, that we were saying what makes a lameness more a nerve problem rather than a bone problem, so a neurological versus an orthopaedic problem. And many lamenesses in neurology cause dogs to yelp. I mean, they cause real pain, really obvious pain. And it doesn't mean arthritis doesn't, because I think it can, but it's much more common when you've got a dog yelping intermittently. Maybe you don't go near them, they just sort of move and they let out a squeal. That for me is nearly always a neurological problem rather than an orthopaedic problem. So
nice.
And that's common with disc disease as well.
Okay, no, that's good to know. And what about the things like nibbling and chewing and kicking out and suddenly turning round? Would you lump that as well? Because I was actually doing a consult the other day, and the dog, its reaction to a movement. So he was laying on his side, I moved, and he went, whoa. And I was like, crikey, that's not what I was expecting. Would you say that would put a red flag up for you?
Yeah, I think that what's happening there, and I don't know, nobody knows, no one can talk to dogs yet, but I think that's like a sciatica type pain. So You
Yes.
get dogs that get shooting pains, so they'll suddenly look round to their back end and sort of, oh, what was that? As if someone had poked them with a needle or something like that.
Yeah.
And so I think that's a sciatica, which is a shooting pain, and that can come about because you've got a trapped nerve or a disease nerve, whether it's a slip disc, whether it's something else. But absolutely, seeing that for me is much more towards the neuro end than the orthopaedic end.
Yeah. It's the first time in years that I actually took the fetal position because it's a massive dog. And I wish someone had filmed it because he turned around and he really went for me. And I was like, wow. And then you can immediately see him go, I'm so sorry. I'm just so sorry. But whatever just happened was excruciating for me. And that's the only way I could tell you about it. But yeah. Woo! I was like, I'm under the table. But okay, so and what about nibbling and chewing and stuff like that? Do you kind of put that in the same, or
that's a bit harder?
So?
I mean, definitely nerve pain can result in pins and needles sensation is what I think that is. So you've got dogs with well, not always, but I think that's part of it. They're getting like a pins and needles sensation, and I don't know, if I was a dog with that, I'd be, when your hand goes really numb, you'd be chewing away going, what's going on? So I think that's one possibility, and that would be nerve pain. But you can get that for a number. I mean, there's all sorts of things. I mean, skin disease is a common one there as well. And then we're going whole into a realm of something else where they've got a lot of problems with their skin, and maybe they're licking at their feet, they're going at it a lot. So it's really hard to know the difference there. But definitely, we can see dogs licking and chewing at their feet because of pain. That certainly happens.
And I think that's a really good opportunity just to help some of the CAM followers understand that in our world where they don't talk to us and they don't give us all of those additional clues, we do have something called exclusion diagnosis. And there is certain pathways that we follow in our investigations that are to exclude. It's not this, and it's not this, and it's not this, and it's not this. So it's now more likely to be this. And you're talking about a classic. You've got a dog that's got pododermatitis, so it's got really gnarly, manky feet, hair loss, it's inflamed, it's sweaty, there's erosions, the nail beds are all brown and crusty, and you're looking going, is this skin disease? Is this like Demodex? Is this something that, so let's get skin out of the way. Let's do plucks, scrapes, sellotape strips. Let's look into this. Because actually being able to say it's pain related or pins and needles, that's more of an exclusion diagnosis. Is that fair to say?
Yeah, absolutely. No, and a lot of these are exclusion. There's nothing wrong with doing a test and getting a normal result.
Yes.
So a test can be a blood test, it can be an X-ray, it can be a really expensive MRI scan. But I think it's always important to understand, if you're doing something with your pet, just make sure you know what's going to happen if that test comes back normal. And it could be a big celebration. That test, that could be a fantastic, it's not got this horrible disease, we've ruled it out. But it's also important to know where you're going next with it. So I always think some of the best vets out there are the ones that are going to be able to help you when results come back normal, as in they know how to interpret them. They're saying, you know what, this blood test is normal, but we can celebrate that. We can be really happy about a normal blood test, because we've ruled out this horrible condition that we never wanted to diagnose your dog with anyway. So massively, excluding disease is a great thing to do. My dad doesn't get it. I remember he had some funny signs that he went to the doctor for, and the doctor went through the whole list of things it could be. He's fine, it wasn't anything serious at all. But he was told it could be diabetes, it could be a tumor. Anyway, he came home for the next week and he told me how he'd been diagnosed with a tumor, with diabetes. I was like, no. He's giving you the things it could be, not what it is. That's just things he wants to rule out. But he had a very uncomfortable week waiting for those results to come back through.
No. But it is true. Like, I was just having a giggle in my head. I'm of the era of Star Trek. And do you remember Star Trek, where they'd be able to like run a scanner over and suddenly had a diagnosis? Just that. Perfect.
That's
amazing.
What we all aim to be.
Yeah, and it is so far from the truth, isn't it? A test may lead to a test that may lead to a test. And neurology, neurological diseases, I think people need to expect that. So if your vet has looked at your dog and gone, there is lameness, I'm concerned there could be pain, your dog's the right breed, the right age, there's some gross changes that suggest it could be joint pain related, I've got some muscle mass loss, my theory will be that there is underlying musculoskeletal pain, I'm going to put you on a course of a non-steroidal for up to 6 to 8 weeks. He hasn't improved, right? That's not a bad thing. That is part of a diagnosis. So please, I see it on Holly's Army a lot where people come in and go, I've just been put on a course of anti-inflammatories. It hasn't worked. I'm really angry at my vet. Well, actually, no, your vet's doing the best that they can with the information that they got provided. And on the other side of the coin, if your dog had got better, you would have thought they were the best vet in the world. So, okay. So I think we'll be able to talk a bit more about intervertebral disc disease and DM when we now start talking about a consultation about how you do a workup. I'm going to let you take it away. I'm just going to sit here and drink Brewdog. By the way, if anybody works with Brewdog and they'd like to sponsor Cam, we are looking. Tell us about a consultation and how you work from history, dynamic observation, static, palpation.
Yeah, well, I can tell you how I work or how other people do it. But no, what I like to do, I actually like to sit on the floor because I'm a bit different to other vets in the sense that you'll have your own vet that you go and see, and hopefully they get to know your pet really well. And I'm a bit unfortunate in that way that I get people who come and see me who have got their own vet and they've been sent to me because I'm looking into a neurological problem. So I don't have that benefit of knowing the pet before they come in. So I like to sit on the floor while I chat to the owners because I want the dog to come up to me in their own time, and they may not, and that's fine. I'm not offended. I just know that they don't want to come and see me. So I know from that point of view how to be with them. Whereas some will come up immediately and have cuddles, and then we're all happy. That's lovely. So that's the start of it. But the other thing I want to do is I always want to get from an owner what the problem is. Now that sounds really silly thing to say, but it's really important to check what the owner's problem is, because I know a number of times that I've seen dogs that have been sent to me where they've come in with a problem that the vet's given me. They said, this dog's coming into you for lameness. But then I might speak to the owners and they'll say, actually, I'm much more worried about the fact it's been vomiting every day for the last 5 days. Now, they're extreme examples, all right, just to demonstrate the point. But I want to check what the owner's concern is, because we're very good as vets at picking up things that aren't right, but it doesn't mean they're a problem. Sometimes they are, and I'll accept that. There are things we'll pick up that we really need to get on top of and treat. But I want to check that we're doing the right thing for the owner, because if you come in with a problem with me and I find something else and fix it, but you've still got the first problem you came in for, you're not going to think I'm a very good vet. So
no, and then you're not going to come back and deal with all the problems that need to be dealt with, because you've lost a bit of trust with that clinician, haven't you?
Yeah. No, so that's really good. And there may even be at that point, it might be the problem that they say to me is something we can't do anything about, but we need that conversation. I don't want to spend lots of time and effort with that pet, putting them through a whole load of tests just to give them that outcome at the end. So, I think it's really important they know it may be something we can't fix, but these are the options if you want to investigate further. But while I'm doing that, I'm watching the dog walk around. And are we allowed to mention cats on here?
Yeah, of course, yeah.
Can we mention cats? That's not a dirty word on here, I don't know. So cats, the reason I mention it is cats don't do that. Cats, you bring them in your basket, you pop them down. There's a conversation that happens with you and your vet, and then you get the cat out for the examination. Now that cat is then really wound up, and won't let anyone go near them if they're a normal cat. I've got a cat, so I know what my cat would be like in the vet. So letting the cat out of the basket is great to let them wander around, but we know cats don't do that. They don't wander around. No. So even better if, and this goes for dogs too, but I give the example with cats because it works better. If your problem with your pet is it's not moving around normally and you're seeing something odd at home, then video it. We've all got smartphones nowadays or something that will allow you to video what you're seeing and take it to the vet. So when you go, my cat's really lame, and then you're trying to encourage it around the room, which you won't want to do because it's really lame, then you can show the video and go, this is what it did last night. And I find that helpful. And the reason
you can slow-mo them as well. You can slow things down, and you can look at it with the owner and go, this is what I see. And that's one of the frustrations when you're a clinician working on your own. The owner has to walk the dog up and down, and you really want them to actually stand next to you and go, that's what I'm seeing. What are you seeing? And on your phone, you can do it together. It's great.
Oh, it's perfect. And honestly, I mean, what I'm leading to, because this is all the consultation still, you're probably thinking, well, I only get 5-10 minutes from my vet, but this is all going on in my head. And actually, and it sounds, this is my feeling, right? So this is only an opinion before I say more. But I find for me with neurology, I get so much more from speaking to the owner and watching than I do actually examining a pet. So the examining bit can be very stressful for a pet. Doesn't mean there are some dogs that love it and they actually enjoy it the most, but there are a lot of dogs out there that don't want to be examined. So actually, all this groundwork I'm putting in is to therefore mean I can really select the tests I need to do on that pet. So I don't have to do a 20-minute exam or a 10-minute exam. I can really pinpoint the things that are important.
Perfect. So
So
what
that
kind of things? Yeah. So the owners come in from the waiting room. They've come and settled. They've nuzzled. Not the owner, the dog. That would be weird. So they've come out and then done a little appeasement thing, a bit of a friendship building thing, and then the dog's scooted off around the room, and you're watching. What kind of things are you picking up on, just so people know what you're seeing?
Yeah. Well, a really common one that people miss at home, but I watch for, is a dog with a neurological problem can come in and just pace around the room constantly. So they can go round in circles, they can go figure of 8, but they'll just constantly walk around. And it's funny because that sort of relentless pacing isn't normal for a pet. And you'll ask the owners, and sometimes owners will even say, because he's in the vets, he's nervous.
Yeah.
But actually, if they're doing that, that's still, it can be quite compulsive. And me seeing that is an immediate warning sign that there's something not right with that dog. There's something a bit more abnormal. You get a chance to see the gait. You definitely do. So you get to see all the lameness, the drunkenness. I'm really looking out for that. That's a key one for me. And the other thing is their eyesight. So, we need 2 eyes to see properly. And if we have 1 eye, we can't judge distances anymore. So if you just had 1 eye and you try walking around your room, maybe your living room's a bad example because you know where all the furniture is, but try walking around when you've moved all the furniture around. You'll find you might bump into things. So a dog in an unfamiliar environment like the consult room, without normal vision, they may be able to see, they'll still be able to see you, they'll be able to see their food and all of that. They'll be bumping into things, so bumping into the table, and they'll say, oh, what's that? And not realize it's coming up to them. So all these things help me then to know whether that pet's right with their neurological system or whether there's something a bit more worrying.
Perfect. And then what's next? Now we do lots of practice training and trying to get across to like clinicians and vet techs and vet nurses, go for minimal handling and then build. So we always suggest to people start with like what we call a pain scan, where you're just looking at what the dog's reaction to where you touch and whether they try and sidestep, whether they look and kind of go, whoa, no, but they dip away. Well, maybe even kind of, please don't. So pain scan, clinical exam, which is your typical TPR. Look at teeth, look at ears, look at gums. Then the neuro, because orthopaedic exams hurt. If you're doing an orthopaedic exam, you are trying to elicit discomfort so you can localize where the problem is. And getting the neuro exam, because the neuro exam isn't painful. Is that fair to say?
Yeah, no, I think that's absolutely true. Most of the neuro exam you're absolutely fine with, and a lot of it's hands off actually, so you don't need to touch your dog for some of it. Like we've got silly tests, and they're kind of obvious things to say really, but to check a dog's vision, we can't ask them if they can see. So we do like a menacing gesture in front of the eyes to see if they blink. So if I did that to someone, the normal thing is to blink or to move away or go, get away from me, and then they can see. So that's what we're looking for with a dog. It can look a bit funny. If you don't explain it to an owner, it can look like you're being quite mean to the dog, but you're just trying to check they can blink in both eyes. And the beauty of it is you compare both eyes, because I've said already, many of these dogs can see, they just haven't quite got normal vision. So you may find one eye, they blink really well, and the other eye might be a little bit reduced. So there's nothing painful about that. And even the dogs that don't want to be examined will let you do that quite well.
Yeah.
So a lot of this is still hands off, not going too near to the patient and doing that. And the other thing I'd say is you get dogs that can be really severely affected with spinal problems. So they're dragging their back legs. They're literally knuckling them over in front of you and they can't walk. Now, there's a test we do where we do knuckle the paws over to see if a dog can replace it. So we kind of knuckle it over, and they should replace it pretty quickly on both sides. If you're paralyzed, and of course you turn your paws over like that and you can't move them, there are many dogs where you'll see that, and you don't then need to do this because they're doing it for you. You can see there's a problem there. So the only reason I'd ever check paws and start checking them, because dogs don't like their paws being touched. So the only reason I'd do it is if it's something I haven't quite been able to work out from watching them. But if I've watched them and they're ataxic, I can skip that step and then move on and sort of see what's going on. So there are some bits you can just completely miss out of your exam if you've had the opportunity to watch them walk around for a bit.
Yeah, perfect. And just tell other people other sort of things that you might do. So the reflexes and pinching. Just to, what we want is camfullers to go into that consult room and feel comfortable what the clinician's doing. So are there other things that they might see?
The other thing you can do is you can hop a dog as well. So they stand with all four legs on the floor, but you can pick up one front leg and hop them on their left leg, and then hop them back. So it looks like a weird dance move you're doing with them, and you do the same in the back leg.
And it also looks quite stressful at times. And I can remember we did a Facebook Live a few years back, and an owner made a comment about how can you do to the animal? That animal is obviously distressed. Like, well, there's sometimes a seesaw, isn't there? Of what am I going to get out of it? Is it worth the stress it might create? And I'm sure, doctors with children are like, oh, I know the kid's not going to like this, but this is really quite important that I get this information. So the hop test and the wheelbarrow and bits and bobs like that, I do know there's sometimes owners have looked at me and gone, what the fuck are you doing? But it's quite important to get that information. Describe to them what you're doing.
Yeah, so what you're doing there is you're looking to see that dogs can stay upright. And it sounds silly to say that, but a dog that's normal and can move its legs well will hop and will stay upright. But if they've got any kind of weakness, whether it be the nerves, whether it be the spine, they will actually fall over. So as you do it, you're very careful to not let them fall over. So you are doing it with support. And sometimes you won't see a dog falling over as a vet checks them because they are deliberately trying to keep them upright, but they're just feeling if they're falling onto them as you go over. So that's what you're doing there. And we're just, if we know they can't hop normally and they're falling over, there is definitely a nerve or a spinal problem there. That's what we're coming down to. And it just helps us maybe rule out things like arthritis as being the primary cause and, knowing there's something else going on. Reflexes are the other thing. I mean, they can look a bit funny. I mean, the main reflex, you've got things like where you get a reflex hammer and you tap their knee. I'm not a big fan of it, I'll be honest. It looks great, and you can do it on people, you can do it on dogs, and you can find you both.
It looks great, isn't it? It looks so traditional.
Well, also, knowing what vets are like, I mean, you're right, yes, we like to think we do a good job, but we're not necessarily always the most organised. And when you need a reflex hammer, you're never going to find one. So, yeah.
And you're using the scissors, aren't you? You're using the handle of scissors.
I've seen people using mobile phones. It's the modern day patella reflex. But so that's one thing. But the other reflex you can do quite easily is to very gently pinch the toe. Now there's two things I'll talk about here. This one is where you're looking for a reflex. You gently pinch the toe, and if I pinch someone's finger, well, they're going to kind of pull away and go, get off. So I'm not doing it to hurt the dog in that circumstance. What I'm actually doing is just to see if they pull it away. And if they can pull their leg away really strongly, I'm really happy it's all intact. Sometimes you pinch them and you find they only pull it a little bit. So you might feel them still pulling hard, but they're not bending their whole limb. They're just pulling it up to a point there. And then almost you see it tense as they're trying to pull it away. So that's helping us again to work out if it's more of a nerve disease or whether it may be something elsewhere in the spinal cord. So that's a useful step.
Or orthopaedic. So if you pinch something and they circumduct it, they want it away, but they can't actually flex through their joints, so they swing it.
Yeah, exactly. Yeah, that's right. Just bring it away without doing it. And again, that would be abnormal. But the other thing to say there, and this is the thing that I think is not nice for owners to see, is when you actually pinch a toe to deliberately see if the dog can feel it. Now, I have to say, there's very few occasions, fortunately, that we need to do that. But there are very serious times, and the time when I would be doing it would be when I have a dog or a cat that's completely paralyzed in their back legs. So these are the poor dogs that present that really aren't using their back legs at all, and they are dragging them. So really from the waist down, they've got no movement. Now, the reason we do that then is when you haven't got any movement in your back legs, it tells you all the signals from the brain aren't getting through to the back legs. But we want to see if any are. And sometimes dogs cannot move their legs, but they might still be able to feel their legs. But of course, you can get cases where it's so bad that they can't feel their legs either. So what we do there is we pinch the toe and we're looking for the dog to turn around and say, ow. But I do it really gently because, like you said, you don't want to go right in there with a full-on pinch. So you just pinch harder and harder until they react. So normally, dogs should, a normal dog will tell you pretty quickly, that's not okay. I can feel that. But in a dog that can't feel their legs, you sometimes do have to pinch quite hard. And it's not nice. But what I'd say is when a vet does that, if your dog can feel it, well, that's great. So if you do get a reaction where your dog really can feel that and it clearly looked like it hurts, well, that's good, because
that's actually a really positive sign, isn't it?
It is. So I say that to him. I say, look, if he feels this now, we can be a lot happier. We can then build on this, and there's hopefully something I can do. So yes, all right. You've got to see a bit of that to just check what's going on. But if we get that pain reaction, then great. We can try and go on and fix it.
Yeah. So I think that kind of section of the life has really demonstrated to people that there is a lot happening in a consult room. And I think, I've been a vet for 20 years now. 20 years. And I'm still really proud of being a vet. I love being a vet. I think our profession's amazing. And I want people to realize that vets in that room, in that 15 minutes, their brain is going. And they might look like they're not doing very much, but they're listening to history, they're looking at your clinical notes, they're observing your dog, static, dynamic, they're palpating, they're listening to your concerns, your expectations, your needs. And they're trying to come up in an amazing algorithm within 5 kind of minutes of this is the best plan of action. And, there is a lot going on in quite a short space of time. I did a course with the University of Tennessee with Darryl Millis, Professor Darryl Millis, and his rehab exam, which has got an orthopaedic component, pain component, neuro component, 2 minutes. He's simulating all of it within 2 minutes. So when your vet is kind of leaning over your dog, kind of talking to you, looking at your dog, having a glance up at the computer screen. So that's a big take home from that. I think what would be really nice before we go and do 10 top tips is we've talked about a couple of common diseases, that are mistaken for OA or musculoskeletal disease, and they're actually neurological. Let's not leave people hanging. What are the sort of interventions for? We touched on laryngeal paralysis and the peripheral neuropathy and the fact that surgery was really beneficial. But what about things like IVDD? What kind of things do you find that you're routinely prescribing? Because I want people to go away going, oh, actually, that's worth looking that into, because there are options.
Yeah. So intervertebral disc disease, it comes in so many different severities. So you get dogs that are relatively mild, and I say relatively because they're still clearly affected, but they're relatively mild and may have, the only sign may be pain. So it might just be a dog that's yelping intermittently. And then you get right down to the other end where you have dogs that are completely paralyzed and lose feeling in their legs. So what I'd say is if you've just slipped a disc, so if your dog has just slipped a disc today, say, what you're likely to see is the dog might have yelped and then may have become a bit stiff, weird. Sometimes it can just look like a dog has a bit of a stomach upset initially. So Dachshunds are a common breed that we see slip discs in. And if I look back on all the Dachshunds I've ever seen that have slipped a disc, often there's been a few days beforehand where these Dachshunds just look a bit off colour, and their owners will say there's just something not quite right. Now, I'm not saying every Dachshund that's off colour today will slip a disc tomorrow, so don't worry, but that's just something to think about, that in hindsight, that might be what's happening. So when you have a dog that shows that sort of pain initially, the best thing is to do exactly what we would do, which is bed rest. Well, I say we would do it, the doctors would tell us to bed rest. We'd get bored as soon as we're feeling better and get up, make tea, run around the house. So you want to rest, and that disc is a ligament. And what's happened is the ligament has torn. So any torn ligament in the body is really sore. So you want to literally rest that dog's back as carefully as you can. So if we're doing the best thing for your dog's back, the best thing we can do is literally hold them. Don't let them move at all so everything can heal. So we actually say cage rest is the best thing there. Now, that's not ideal for dogs. We've got to think about them as well and what they'd want. And we might not be able to give them everything they want because they can't go for walks, but maybe just confining them when you're not with them, when you're out the house. But if you're watching the TV, if you're watching your cam live, you have them with you, have them sat on your knee. That's fine. That's cage rest, and they're with you. They hopefully they like you. They want to be with you. So that's really strict rest. That's the first thing to do. And of course, pain relief can be given, but I make it really clear that pain relief is to manage the pain. It's not going to fix the disc any faster. Yeah. So you don't always need pain relief. Sometimes a bit of pain is a good thing. And I come back to us that if we've slipped a disc, yes, you take ibuprofen and anything stronger that you need. But you want to reach the point where you don't want to have so much pain relief you're then up and about running around, because that's going to make it a lot worse. And I say the same for dogs, that, you know, the right amount of pain relief is what we should give. And you'll ask, what's the right amount of pain relief? But it's enough that they'll stay rested, but they're not screaming or showing obvious outward signs of pain. So we keep them like that. And if they stay the same, and what I mean by that is if they're not worsening, getting lame, getting ataxic, dragging their back legs, if they're not worsening hour by hour, day by day, that's a very reasonable thing to do. And we do it for 6 weeks because it allows the ligament to heal. Now, at the end of all that, hopefully things are better. And that's all you need to do when it's a straightforward disc that doesn't worsen. That sounds great, I know, but there are dogs that worsen. And that's where we get a bit more worried. The dogs that do get more and more wobbly, it can be a rapid thing. I mean, it can happen all at once. It can happen over hours or days. But if they then lose the ability to walk, that's when we have to start thinking towards the other end, where we have to do more surgery to actually go in and remove the disc. But I would say, if a dog can, as long as a dog's able to walk or move its back legs, there is, we expect dogs to get better with surgery. So if we remove that slip disc, we expect those dogs to make a really good recovery. The time when it's a bit iffy are those dogs that have lost the feeling completely in their legs. So when we're pinching the toes and the dogs aren't looking around and reacting. So that's when, you know, it depends on timescales there, but it may be 50-50 chance of recovery with surgery. It may be a lot less. But as long as you've got a dog with feeling or better movement, then there's a really good outcome with surgery. But all I want to emphasize is the rest is reasonable. So don't be afraid. Don't think rest isn't ever an option. It's always an option. It may not be that dogs don't get better, but it's always an option.
And is there, I can remember talking to a clinician, there are rough percentages of those dogs that they'll do the rest, they'll get improvement, but suddenly they will deteriorate again. And I've had owners that have then beaten themselves up about it, in that they feel guilty. But there is a percentage that the rest was done correctly, the cage rest was done correctly, and unfortunately, once they go back to being mobile again, it recurs.
So what I say to people, and the stat there is on that, is if you rest your dog with a slip disc, and let's say it goes well and they get completely better, at least half those dogs you rest are likely to go on and relapse at some point in the future. So you're right, you know, you might get a dog that has done really well and we're really happy with how they're doing, but then a day later, a week later, a month later, 5 years later, they could slip a disc. And so they'll always be at risk of that if we don't operate. Now, that's what I always said to people. And then I always said, well, actually, if you operate, the one thing we can almost guarantee is that disc will never slip again. So pretty much in all cases, if you operate and you do a good job, then the disc shouldn't slip out again. But there's actually been something really interesting written just recently in the last couple of weeks, where there was a study out of Cambridge, and they found that dogs that get operated on, they still have the same chance of relapsing, but they're not relapsing at the disc that was operated on. They're relapsing at one of the neighboring discs. So I would add to that yes. So I'd always said, you know, that's a reason for going for surgery, that they don't relapse, but actually they do, and they've got the same rate of relapse. So I think it adds to what you said, that people may feel guilty. They rested their dog and they could have operated, but I would actually say to those people, if they'd operated, they still could have had as much chance of a disc going again in the future. So we have to accept, you know, that there are things aren't always ideal, you know, and these bad things can happen.
And I think I just want to take this opportunity to say that something that I found since I've been hanging out with awesome folk like you who are specialists, you know, you're at the top of your tree. There's many situations that you say, this might happen, or that may happen, or I think this will happen, or we would expect this to happen. There's a real honesty of no one always has a promise. And when I see, and this is me going off track, I see people online that may be marketing something, and they're like, yeah, definitely, 100%, definitely going to work. And I sit there going, if you have anybody say to you, this is definitely going to work, I'm like, run a mile. Because when you speak to people like Mark, who you've done thousands and thousands of surgeries, you'd never say that, would you?
No, that's right. Exactly. No, people who guarantee things, you've got to watch out with. Now, I would say the one thing I occasionally guarantee in a consult room is being able to find the answer out. Because sometimes you can see a problem and you see, well, actually, I know it's one of a few things, and with this test, we'll be able to work out what it is. But absolutely, when it comes to treatment, there's no guarantees. You know, there's a lot of hope. There's reassurance that it should go well, but we can't guarantee a thing in that way. And we're all human at the end of the day, and we're at the liberty of science, which is not always a clear-cut thing.
No, absolutely. Which is an awesome point to leave on. So I'm just going to quickly. This is just a beautiful message. Did you see this?
No,
we all want to know. We all want to know what paradoxical pseudomyotonia is.
Oh, I know, Jane. No, of course, bless her. No, wow, that's yeah. Well, you know what? It's a good one for a cam video because so these are spaniels, and they get this condition where as they're running, they get stiffer and stiffer, and they can actually collapse in severe cases, and it can affect their breathing too. I know. I hope Jane won't mind me saying, but Max was a dog that had some problems with his breathing as well. But when he went onto the right medication, he did really well. So he got through that well. It was always there for him. So no, he's obviously had to change his life and how he got on with things because of it. But he did well. So yes, a bit of it. You said it perfectly though. I like that paradoxical pseudomyotonia. So yeah, brilliant.
Oh, yeah. And actually, I'm staring at it for about 5 minutes, going right, get this one right. We've got right. Being recently told my 13-month bully mix is showing hip dysplasia on x-rays, but it might sort itself out as she gets older. She's certainly displaying pain in behavior on pain trial now and fast improvement. Good job. That's nice to hear. My pug drags her toes, being wobbly, finding it hard to walk. My pug is ataxic, stiff, drunk, looking like she's just had a CT scan. They think it's neurological. So what about pug? And somebody talks about pug myelopathy.
Yeah, no, pugs, there's a few things there. Often depends on the age, but there's a few things they get. So they get a lot of problems where they form cysts in their spinal cord. It's got a very long name, arachnoid diverticulum, but for you and me, cyst, because I understand that better. So a fluid bulge that builds up and it pinches the spinal cord. It makes them go weak on their legs. Now, it's not normally painful, but it would cause a lot of what Penny's saying there, with the dog getting wobbly in the back end. So that would be up there on my list. The other thing, they get wedge-shaped vertebrae, these dogs. And actually, I'll put any brachycephalic dog in. So pugs, bulldogs, they're quite prone to a triangular bone rather than a square bone. It just kinks the spine a bit, so it can cause pinching. That's usually much younger dogs. So I don't know how old her pug is, but, if it's a dog under sort of 18 months, that's more what I'd be thinking. If it's over 18 months, I think a cyst, but then don't forget IVDD, intervertebral disc disease, is another big one.
And also pugs are really up there with the hip dysplasia. So, I think sadly we see pugs walk weird. Like people accept pugs walking weird, don't they? They've got their back end that when they shake, the legs kind of flop and then they wiggle from their waist and they're always front end heavy. And it's almost sad because a lot of people are beginning to think that that's just normal for pugs, but there's actually underlying conditions, be it neurological or orthopaedic, which is very sad.
It is sad, really. No, so yeah, I mean, that's where it's helpful to know. I mean, she mentions ataxia there. So if there's a drunkenness, I am more neuro, but absolutely sometimes it can be really hard to tell. And I've seen a lot of dogs where I think one thing, and we find actually, no, it's probably not ataxic. It is more stiff and it's more hips. So it can be really hard. And you're not going to get an answer in a quick consult with a vet with these sorts of things. These are really hard problems that people are mentioning on here. But we look into them.
And would you say, just being a first opinion practitioner, the smaller the dog, the more blinking difficult it can be, because they're kind of like they're moving faster and they're just moving, and you're like trying to get down at ground level, and you're like, oh God, you're a tiny little thing, and your legs are going everywhere, and it's really hard. So slow-mo video, land-based, ground level, really helpful.
Really helpful, yeah, really good.
I can't remember what this was. I think this must have been about when we were talking about laryngeal paralysis.
Yeah, this will be geriatric onset laryngeal paralysis. So it is, what this person's talking about is what we were talking about. So you mentioned the dog you had that had the laryngeal tieback, didn't you? So that would be an example of GULP. So it's an abbreviation that comes up from time to time. So a degenerative neuropathy is effectively what we're talking about in that circumstance. Yeah. So it's the same thing. Too many names.
Too many names. We've got a lovely one here. Fabulous Live, my own pointer, 11 plus, several OA joints, Cushing, spondylosis, spinal compression, 4 episodes of vestibular syndrome, and last one left him unable to move for a week. He has recovered, but MRI and spinal tap all clear, so don't know where to go from there. He is super lame on right carpal joint and super weak on hind due to spinal compression. Any suggestions? Ooh, that's a lot going on there.
This is the thing, you get dogs that have all of these problems, and there's clearly a number of things going on there. And that's where it's important to kind of think, well, what is our main problem, and go from there. Because I think there are 4 episodes of vestibular syndrome there that have happened, and that's making me think a lot more of brain things than it is of spinal problems. But clearly, you've still got things like spinal compression and stuff like that going on there. So there's a lot of things that need to be picked apart to work out exactly what we do to focus in on it. It looks like a lot's been done already. I mean, it's very hard without seeing more, but that's
no. And I think
generalist,
generalist tips in a first opinion sense, because this is not Mark, I'm a Hannah. Objective monitoring is that you've got to work with your vet and give them as much information about whatever they choose. So if I was thinking to myself, weak on the back legs, but we've got Cushing's going on there, we've got spinal cord compression, but that right carpal joint's really painful, it's throwing their weight back, and now they're going into their vulnerable zone because it's so sore. Can we help with the pain so we can bring the weight forward? How is that working out for you? I'm going to give you a non-steroidal. We're going to do maybe a bit of laser. We maybe do some joint mobilization. It's going to work on the neck and the shoulders. Has that helped enough that dog's thrown its weight forward, so we're not so wobbly and so vulnerable? But what have you seen from my intervention? And no vet is going to give you some pink pill that's going to sort that out. It's going to be a juggle of this intervention, that intervention. Let's modify this. Let's support that. Have we got to help them up harness for when they're on, getting from a lay to a stand? Does that make enough difference to that dog's life? If you think about it, if you're weak and you're painful, even just getting up is going to push you. If you're doing it on a slippery floor, it's going to flatten you, so those sort of adjustments, what impact do they have? And it's going to be a long-term project. That's what
there was one thing actually that I'd want to pick up on that they mentioned. They mentioned spondylosis. And the only reason I want to bring it up is simply to say that, generally speaking, so spondylosis, for people that don't know, is when you get a lot of arthritic bone between the vertebrae. So you've got all these bones in your back, and you get what we call spondylosis, so bridging bone between them, almost like the bones are all trying to form a big long tube that's all bone held together with bone. And the only reason I want to bring it up is we see it a lot. We have it a lot. I think if we all had radiographs of our spine, we will have it in a number of places. But I would go almost as far to say that it never seems to cause a problem in dogs. So we see it an awful. The breed I'd pick out would be a boxer. You can get boxers where you radiograph their spine and it looks horrendous. I mean, it will look terrible. But what tends to happen is the bone forms below the spine, and there's nothing there that causes any problems. It's the nerves are all above the well, sort of in the middle of the spine, if you like, above where the bone's forming. So when I see spondylosis, I'll be honest, that's something I'd be fairly happy to rule out. So if that's any help, that's one thing I'd always say. That's probably less likely to be causing all the other issues, but the other things probably are more pressing.
What about when you see spondylosis, but you also see disc space narrowing and sclerosis of the end plates and stuff like that?
That's a good point. Yeah, so that's different. So, and I think these two are hard. And I'll be honest, I still think I struggle. So I can see an X-ray of a dog with spondylosis and a dog with what you say. So it looks like spondylosis. So you've got a lot of new bone, but actually the disc space, rather than having a nice gap, there we go, that's it. It's collapsed like that. And it looks really fuzzy on the end. And so that would be, it's got a terrible name. It's discospondylitis. There's nothing disco about it. It's an infection in the disc and it causes pain. So that very definitely needs antibiotics and is a bit more sinister. So there's a challenge there. And I think vets find this difficult. I find this difficult, trying to know if it's spondylosis or is it discospondylitis where there's an infection in the disc space.
Well, could you, so you've got that, but is there also like a degenerative where there has been some IVDD? So you've got some disc movement and you've got sclerosis, or is that?
Yes.
That...
Yeah. You're making it much harder. I was trying to make
I'm sorry.
No, you're right.
I want people to realise that there's times that you're sat in front of the X-ray going, It's true though, isn't it?
Well, no, with what you said, that would be a slip disc where that ligament I was talking about, the tears, when it ruptures, you get new bone sometimes filling in there and it calcifies. So it causes this sort of arthritic bone around there. So that can happen. But when you get along lots of bones, that probably is more a kind of spondylosis, so more an innocent type thing. If it's over one, then yeah, you'd be thinking maybe there is an issue here. But if you've got lots, that's a bit more serious.
Yeah,
sorry,
again, No. But dish. Was it diffuse?
Yeah. Is it diffuse, disseminated idiopathic skeletal hyperostosis? I think.
Oh, you're so good. You're so
But I
good.
don't know. I might got that wrong.
It's right. That is right. I saw that about 10 years ago in a dog. I was just like, oh my God. The whole back, lumbar spine, fused, solid.
It's just a whole bone, isn't it? It's like the spinal column. It's just become one big bone. That's what happens. So, but they get around amazing. You wouldn't know to look at the dog very often.
Yes.
They'd be jumping around and catching balls, running along the beach fine.
Yeah, that is actually very true. So we've got a vet physio here. Can you explain tremors again, especially alongside chronic OH? Should they be primary concern if get worse? This is a big topic, and there is a Facebook Live where we speak for an hour about all of this. I do think that definitely in the rehab community, there's always that fear, because our sole intention as practitioners is to reduce pain and improve function. And if you've got a dog that's got tremors, is there a pain component that you're not doing your job well enough? Is that dog leaving your 45-minute session where you've done manual therapies, laser therapies, thermotherapies, all these different things, and there's still that tremor? Can you help us therapists, with any commentary?
I think all I'd say about tremors, and I hope this came across in the last Facebook Live, but I'd want to reiterate it, is that tremors tend not to be painful and are rarely related to orthopaedic disease, because you get a little bit of a tremor, like you'll stand up and they'll briefly just shake, because they're painful. But actually a constant tremor, that's a bit unusual for orthopaedic disease. When I see them in dogs, it's usually more either an old age dog thing. So dogs are getting older and they are getting a bit sort of doddery in their legs almost, but it doesn't mean they're painful. So I'm not worried about them being painful. So it usually means I'm quite happy in those circumstances to just make sure we know what is going on and what's causing them to be presenting to the physio in the first place. But then, go on and manage the fact. Now, it might be you've got a dog that has gone to the physio just to have physio, which I'm a big advocate of, just dogs going for physio because it's great. I think it just really helps, like we do. I don't do sport, but I don't do anything. I have no activity. But if I was more active, going to see the physio would be a good thing for me. It would be a good thing for me anyway. Yeah. But the same's true of dogs. So doing that. So if the dog goes there and the physio is picking up a tremor, always worth getting the vet to check it out. But I would say not to be too worried about pain in many cases. Often it's something that's not painful related. It's something else going on. And it may be something we can't do anything about.
Yes, and that's a definite take home from your last live, where there's almost like the benefit of knowing that you've worked it up, you know what it is, and there is nothing we can do about it, but it's not painful, so it's okay. And I got a lot out of that live. I'll put the link, guys, so that you can go and listen to us. That was last year.
Was it? It feels like yesterday.
It feels like yesterday. And this is the last one. My mini Schnauzer had an FCE in April 2020. One diagnosed by MRI, 8.5, recovered extremely well. Now only has maintained hydrotherapy and home physio. I can't find any literature on long-term outcomes. Is there any? What a question.
That's good. Actually, it's not a disease I've mentioned tonight. I'm pleased that's come up. So FCE, the long name is fibrocartilaginous embolism. So let's stick with FCE. And it's where, the way I think about it, it's where a dog has a mini stroke of the spinal cord. So these dogs tend to be really normal, they're often running to catch a ball or something like that. So doing something quite high impact, fun and fine, but high impact stuff where they're running, they jump up to get a ball, they'll then yelp and they'll have some degree of weakness in their legs. Now, it can be really bad. I mean, these dogs can suddenly, out of the blue, from being a really healthy dog, become completely paralyzed. But there are other dogs that may just be a bit wobbly and so on and so forth. There's a whole lot of stuff of how it happens, but I'm basically thinking it's a blocked blood vessel in the spinal cord. Now, we can't do anything about that blocked blood vessel. That's blocked and it's done. But what these dogs can do is they do tend to make a good recovery. So if they're not really severely affected, so again, if they've lost feeling, I am a bit bleak with these dogs. They're not always great when they've lost feeling. But if they can feel their legs all better, they've got a reasonable chance of recovery. And the less severe they are, the better they get. I think the figure that people say, again, going back to what people have looked at when they've looked at lots of dogs that have had an FCE, it was once said that the best recovery for a dog is 3.75 months. So what's that? It's nearly 4 months after the initial injury. But I dispute that a bit, not because there was any problem with the study. I mean, I think, with what they looked at, that was right. But I do think that dogs can still improve months and years later. And I think the reason we didn't get that in the study was we weren't able to follow the dogs for long enough, because we only live a normal working lifespan, don't we? If someone could now repeat that and look at these dogs right through to years later, 10, 20 years later, we can actually get a really good idea of how well they did. So the reason they're probably struggling, there are long-term figures, and that's the figure I'd give is, 3 to 4 months. But if this has happened more than 3 to 4 months ago, don't lose heart. These dogs can still do well. And physio is huge. I mean, I can't bang on about physio enough for these dogs. And if they like water, then hydrotherapy is a part of that too. That's really what's going to help these patients do well in the longer term.
Yeah, and it's, do you know, it is lovely to hear so many more people talking about physio and rehab practitioners and stuff, because I think it's not been highly explored and rated and advertised for a long time, has it? But it is such an important part of what we do for our companion animals, be it post-orthopaedic, post-neurological. So big tip, guys, when you go to your vet, it might be for a cruise ship run, it might be an FCE, do say to them, and what happens later? What's the the rehabilitation phase of getting our function back? And I think it's always interesting, cruise ship, that's gonna be $2,500 for the surgery. You're like, chuck another 500 on, gonna have some rehab. It's gonna be a 12-week project, guys. So please plan after these events. We've been going for an hour and a quarter and we're done. This is good. We have done well. Thank you so much for coming today. I'm sure that all the followers are going to say thank you. Please do, because these lives take a lot of organising. I want to say a massive thank you to my PA, Sarah, who is now coordinating all of the Facebook lives, getting these lovely peeps in. We have at least one a week. These are people that are giving up their time for free. And I'd like to say that Mark is a CAM advisor, which I'm really, really happy about. But these guys give up their time for free. So please say thank you, because it's really kind of them to give their knowledge to all of you guys. Until next week, I can't remember what's next week, but I will let you know. My big shout out today is we had our first announcement that we are being sponsored by Big Barker. Big Barker Beds over in America are now our primary sponsor, and they are funding CAM expenses for a year. And bear in mind that it's up to $5,000 a month now. That's a big blinking deal. So thank you, Big Barker. See you next week, guys.
Bye-bye.